Into the room. What we need is we need equipment to, of course, wash our patient. Restraints. Okay. We need a bedpan. Okay. We'll need some absorbent pads that we can throw away. We need some lubricating jelly. We need gloves, and then we need our fleet enema or our suppository, whatever we're giving. Okay.
You just went for the tapered bedpan. Is that your go-to for you?
Yep.
Over that one?
Yep. It is. I find it's too difficult to get people on that. Honestly, I would rather Hoyer somebody onto, because we have ceiling lifts in the hospital now, I would rather use the ceiling lift and put them on a commode and put them over the toilet. Yeah. Okay? I just feel like it's, I don't know. I don't know how anybody could do it. Okay. What side does a patient need to lay on? Left. So I gotta switch sides, right? Oh, no. Guys, I'm dyslexic.
This is the really...
Well, they said the left Fowler, but that's the way the picture they had, so go figure.
It's left Sims, isn't it?
Yeah, left Sims, but that's the picture they have.
Oh.
So go figure.
Okay. Alright, yep. Now we're going to put a towel down. Okay, just, alright. We're going to take a couple of these. These are absorbent pads. Okay, they're really great. You can line whatever you need to on them, and then you can throw them out after. So we'll probably need, we might need to line the bed. It really depends how long it's been since your patient's had a bowel movement. All right? We have the bedpan nice and close. Now the fleet enema, you'll just have to read the instructions, okay? This one here tells you that you need to put it in some warm water. So usually what we'll do is just take a bucket, put warm water, and then sit this right in the warm water. Okay? So for probably just, 15 minutes will do you just fine. Then we're going to take a water-soluble lubricant. We're going to take the cap off. You don't have to cut it, okay? I'm going to open up our lubricant. It's not sterile. It's just clean. Okay, so it's okay. And we want to lubricate the whole tip. So they say about 3 to 4 inches. Be generous with your lubricant. Okay? Have I lost anybody yet?
Okay.
Alright. Now what we're going to do is we're just going to take our hand and place it on their buttock and just lift their buttock over so you can expose the anus. You're going to ask your patient to take a nice deep breath, alright? And as they exhale, so when they're relaxed, you're going to insert this the full length of the applicator, okay? It's about 3 to 4 inches, so it's not even that. And what you're going to do is put it in, keep your hand here. When you go in, you're aiming for the belly button. Okay, so her belly button's right here, so that's the direction I'm going. So it's not like this or like this, like that's aim for the belly button. Ask your patient to take a nice deep breath again, and then what you're going to do is just say nice deep breaths, and don't force the liquid out, okay? We're going to start squeezing the liquid in. We're going to look at our patient and make sure that they're tolerating it okay. What can happen is they can feel some abdominal cramping, okay? If she's like, oh, Amberly, my stomach really hurts, then I'm just going to stop squeezing, leave the applicator in, tell Claire to take a couple nice deep breaths, and then once the cramp subsides, I'm going to go ahead and squeeze the remaining of this contents in, okay? Now, what I'm going to do, and that's why I like these, you could use toilet paper, you could use a face cloth. I'm just going to use this absorbent pad and just hold it here and pull out this, okay? And then I'm just going to say, now you need to lay on your side, and you'll have to take and hold that in, okay, for as long as you can. All right? I'm going to leave this close. Really, for a fleet enema to work well, is that the longer you can hold it in, the more time it has to activate. But we're going to leave the bedpan close. We're going to leave her call bell, and I always leave this because let's say it's coming, then they might be able to slip it underneath and help themselves a little bit, if they can, okay? If not, we might want to just leave them on their side and put a brief underneath and just sort of secure it so that if something comes out, it can collect it, okay? So you'll just have to make that judgment call yourself.
So you wouldn't roll them back over
No.
the bedpan, leave them on their side?
Leave them on their side, and I'll say when you feel the real urge to go, or if you just cannot hold that in anymore, you're going to go ahead and ring me and I'll be right there. Okay? Now, the suppository is the exact same. Okay, same positioning, same everything. this little package, and it's a little slippery, so just, I think I might break this. Okay. It's glycerin, so it just sort of slides out. Can you see it? It's like, see, like it's slippery. Okay, so it's going to be a little bit difficult to hold on to. We're going to lubricate it really well. Okay, like probably even a little bit more. Now, okay, so you want it. Okay, so what you can do is we can insert it this way, so pointy side in, okay? Same thing, you're going to lift the buttocks, exposing the anus. You're going to ask your patient to take a nice deep breath, and as they exhale, you're going to insert this into the anus, okay? Just let them just take a minute. You'll feel the sphincter sort of tighten on your finger and then let go. When you feel the sphincter let go, what you're going to do is you're going towards that belly button again. You're going to take your finger and you're going to push this up, okay? And then up again, all right? To go in, it's about 3 to 4 inches. You don't want to go any more than that, okay? And
So your finger, 3 to 4 inches?
Yeah, okay, so for me that's about the length of my finger in. And what happens is, you might be able to feel stool, so sometimes you have to do a rectal check. So you'll put lubricant on your finger, you'll put your finger into the rectum and feel if there's stool there. If you feel no stool, do you think a suppository is going to actually do anything for your patient?
Probably not.
It won't, okay? There has to be stool there. This is glycerin. It'll melt and make the stool slipperier, so then it will come out of the colon. Alright? If you put your finger in the rectum and there's no stool, the blockage is higher up. So we need to give them something by mouth to push it down, okay? Or a soap suds enema, which is like dynamite, okay? And then that will help draw it out. Okay, so for glycerin suppository to work, there has to be something there. So you don't want to put this into the stool. What you want to do is you want to put it around the stool. Alright, now, I mean, this is like you want to get in, get out. So there's like not a whole lot of playing around. I understand that. But for them to work most effectively, that's how it works. Okay? So you're just going to push it into the rectum. Okay? Once you feel the sphincter let go a little bit, you're going to take your finger and push it in. Okay? And just try not to get it and push it into stool. You want to get it around the stool so that it can absorb, like, I say melt, but break down, and then make that side slippery so that the stool can come out.
I know that nursing is not gender biased.
Yep.
But in a case like that, I would assume that a patient would prefer you with skinny little fingers and my big fat
Yeah.
fingers.
Yeah, but then look at obstetricians. Majority are male, and they're right up in there. Get what you get. I don't know what to say. Yeah, I mean, you could be really nice and ask somebody else to do it, but I mean, nobody really wants to do it to begin with, so you might be up. Unless your patient really, the only thing I could see is maybe be uncomfortable with a male, but I don't see it so much anymore.
No.
I have to say most patients are really good about it, and in fact sometimes a male's nicer because they're a little bit more gentle, so a little bit more cautious. So I don't see it as much. When I first started there was a bit of a hesitancy, but there's so many more male nurses now. It's really becoming more of the abnormal for anybody to be like, no, I'm not letting a male nurse come in here. Yeah, so it's great. So that's wonderful. Alright, so that's, we don't do the sups because they're all over the place, but you will be doing the fleet, and I will give you the one that's empty so that you can squeeze it, and all that good stuff.